Greetings, y'all. I am Candace Maria Dru, Columbia, South Carolina native. I am a senior apprentice midwife, holistic lactation consultant, small business owner, and my sister's keeper. I know this conference is for all of my sisters, so I will keep most of my Candace talk geared towards general women's health. Occasionally, I will tie in a bit of my expert advice regarding pregnancy and birth. As you guys will hear during the panel discussion later today, birthing Black women have a higher risk for everything, and there's a reason for that we can easily pinpoint. It's because we aren't prepared to protect ourselves. We don't know how to prepare our partners and support persons to protect us. We just don't know what we don't know. So today, I'm here to shed light on quite a few things that aren't general knowledge. My prayer for today is that the wisdom I share becomes the wisdom that you share. My first point that I'd like to address is, by definition, protect means to keep safe from harm or injury. In order to protect ourselves when receiving health care, we have to do our part in protecting ourselves in everyday life. For me, protecting myself in real life looks like knowing when I need a moment, requesting labs to check my vitamin and mineral levels so my body can function optimally, drinking half my weight in ounces of water daily so that I not only look good, I feel good. This glow you see isn't from a stress-free life. I'm drinking my water and eating intentionally. I'm engaging in physical activity when I have the capacity. I'm a living room yoga kind of girl, or I'll play the cha-cha slide and turn my whole family up real quick. The conference theme, decompressing after a year of thriving, is a powerful phrase. As I meditated with that title on my heart, I had to admit to myself that it is such a daunting phrase for me. So I had to ask myself why. Why does decompressing after this year I've had sound so scary? So I had to ask myself, why? Why does decompressing after this year I've had sound so scary? It's because I prefer to lead by example as best I can, and I have finally admitted to myself that I am struggling. I am tired. I don't have a true planned break in sight. I don't currently have the support or resources to even take said break. I quickly had to check myself because I can decompress while still carrying a heavy load. It doesn't take immense privilege to decompress. Practical ways that we can decompress daily is by taking a few moments to deep breathe. So I would like for you all to try this with me. We will inhale to the count of 4 and then exhale to the count of 8. So let's inhale and exhale. That felt really good, right? Let's do that one more time. Let's inhale to the count of 4 and exhale to the count of 8. Last time, this time, let's set our intentions of our breath to releasing whatever on our heart is worrying us. So let's inhale. Now release, blow it out slowly, control that breath. We just took a moment to decompress in the middle of our Blaze Summit. Decompressing can also look like talking it out, whatever it is. Someone in your life may have the capacity to help you decompress. And if you are still building your personal tribe, decompress with your journal. For the things we aren't comfortable, for the things we aren't ready to talk out, write it out. And when you write it out, close up that journal. Imagine yourself temporarily closing those problems, burdens, situations, or whatever it is. It may not be going away exactly in that moment, but in that moment, you can choose to give it a rest and redirect your thoughts. Decompressing can look like stepping outdoors for fresh air, meditating, calling in sick, taking a day off, reading for leisure, disconnecting from social media. When we aren't mentally and spiritually well, when walking into healthcare settings, we are more vulnerable than we can comprehend, which leads to things being done to us versus for us. We may or may not understand what our options are, or we are so distracted that we are just signing consent forms and agreeing to medications and treatments without weighing our options and fully understanding what's going on. That's how drifting through survival mode can have long-lasting effects on us. During my Candace talk, we will discuss advocacy and understanding our bodies, taking off our mask so true healing can happen, doing our due diligence, protecting ourselves during pregnancy, following up, and sharing our experiences. So my first point, advocacy and understanding. Let's talk about appointment times and doctor visits. Do you feel seen and heard during your visits? Are they too quick to feel confident in your diagnosis, treatment plan, and future plans? Know that collaborative care is okay. It is okay to have an entire care team also. My 5-year-old has an entire care team consisting of an integrative medicine physician, a pediatrician, a chiropractor, an allergist, an ENT, a pulmonologist, a dentist, and a developmental pediatrician. What one doctor can't answer, the next one can. We have to normalize getting a second opinion before making a big decision, especially when you hear phrases like, you will need to take this medicine or treatment for the rest of your life, or you need to have your gallbladder removed. It took a doctor I met online to give me an alternative perspective to gallbladder removal. As I've been told, it has to happen and the gallbladder serves no purpose. When later learning that our livers are 100% dependent on our gallbladder, so we could have it removed and then have lifelong effects that we now have to deal with. Let's dive into diagnostic labs and testing. How often are you having blood work done? Do you know that most of us in the United States are deficient in essential nutrients that our bodies need to function optimally? When is the last time your vitamin D level was checked? Are you taking the vitamin D prescription from your doctor, or are you taking a quality vitamin D supplement that your body can actually absorb? How are your iron levels? Do you normalize chewing ice and being cold? Or do you take a quality iron supplement that doesn't constipate you and disrupt your everyday life? At least once per year, we should have the following labs ran: a CBC, which is a complete blood count, a CMP, which is a comprehensive metabolic panel, essential nutrients panel, which shows our iron, vitamin D, vitamin B12, and magnesium levels, and also a broad thyroid panel that not only tests your T3 and T4 levels alone, those don't give us the full picture of how your thyroid is actually functioning. And the last test we should have, at least once a year, is one on inflammatory markers. Having a CBC and CMP ran annually is vital to understanding our electrolyte and hydration status, kidney function, liver function, and blood cell values. These values will also tell us if we are fighting an acute or chronic infection, having anemia, or clotting issues. Knowing our status in regard to essential nutrients lets us know what we can work on. Knowing our levels for inflammatory markers alongside these other labs is the foundation for preventative care. Mild inflammatory markers are directly associated with depression, cardiac events, and so much more. Next, I'd like to talk about powerful language. Sometimes we have to advocate for ourselves by using language that actually triggers the doctor to listen to us or to move and do more, to actually hear what we're talking about. So sometimes we have to use phrases like, please document my records to reflect that you are refusing XYZ testing. Or you may say, may I speak to the charge nurse if you're working with just your regular nurse on shift? And sometimes to the charge nurse, you may have to say, may I speak to the director of nursing? Because no means no. Know that you have the right to refuse any and everything being offered to you. Your no can be temporary, also until you gain further understanding of what is being presented. Last year, when I was hospitalized for a condition I am still working through, the nurse walked into my room with a vial of medicine and said, I'm gonna put this in your IV now. I said, no, you're not. You're not gonna just do anything. First, you are going to tell me what that is, what it is for, what are the side effects, risk, what is the goal for this medicine, what is the expected amount of time and doses you plan to give me? Tell me more, and then I will let you know if it is okay. So sometimes we have to slow ourselves down in those spaces. Doctor's visits can be so quick, or sometimes they'll just run through things that we may not necessarily understand. Slow them down, ask questions. Don't just blur through things that are really important to your well-being. Which leads me to my second point, taking off our mask. Oftentimes, we are so conditioned to wearing a mask to hide our true feelings, our pain, and our symptoms. If you are interested in true healing, if you really want to protect your body, take off the mask. So many of us are taking prescriptions to mask root problems. That's like putting masking tape on a water leak. That's not protection. Or taking hormonal birth control for painful or heavy periods. Or using BioFreeze for a repeat backache. That's just putting Band-Aids on a wound that needs medical attention. It's okay to not be okay. It's okay to keep going when your body is showing you signs that it needs attention. My next point is to read. I am all about informed consent. Whatever healthcare choices one make, I support them as long as that decision comes from a place of understanding, comprehension, and clarity. Read those consent forms. Read the ingredients, risk, and adverse reactions to medications and injections. The best thing you can do to protect your body is not put a single ingredient in your body that you can't pronounce or that you can't understand. Read your food labels, read every label. If an 8-year-old can't pronounce the ingredients, then they are likely not desirable for your body. Read everything. If you go into an appointment and haven't had a chance to read and prepare, delay all decisions and schedule a follow-up appointment for decision-making. Take up space, sis. And next, my fourth point is protecting ourselves in pregnancy. I had to throw this in as a midwife. I have 5 suggestions for ways we can protect our bodies during pregnancy. Choose a provider that listens to you, respects you, and does not dismiss your concerns. Stop rushing your baby out. So what if your baby is due on Christmas Eve? That is no reason to get induced on December 19th. When we interfere with nature, we are doing the opposite of protecting ourselves. Our bodies were designed with the power to conceive, carry, birth, and breastfeed our babies. Keep your pants on. Consider denying cervical checks if you are not in active labor. You can still deny them then also. To fully inform yourself, weigh the risk and benefits of cervical checks. Your doctor sticking their fingers in you at 35, 36, even 39 or 40 weeks to check and see if you are dilated is harmful. It subjects you to being medically raped, which some practitioners will sweep your membranes without your consent. That can nudge you into labor. But let's say your body isn't ready. That increases your risk for a catalyst of interventions. It also increases your risk of infection, which increases your chance of preterm delivery and needing even more medical interventions. Be more intentional with your nutrition. Black women, we don't eat enough protein. During pregnancy, our bodies require 80 to 100 grams of protein a day. It's best to get as close to 100 grams as possible. Not eating enough protein is a huge part of the reason why Black babies statistically have lower birth weights. Not eating enough protein is a part of the reason why Black women have higher rates of preeclampsia. Stop listening to hearsay and other people's birth trauma and prepare for the birth you desire. Read. If purchasing books about birth aren't in your budget, utilize your local library. Contact your local midwives. Most of us have lending libraries that we are so willing to share with our community. If you can't hire a midwife and a doula, hire an apprentice midwife like myself. I created a virtual service to provide supplemental prenatal care for mamas that don't have access to a midwife, but understand they deserve better than the standard of care through the hospital system. During those supplemental prenatal visits, we go over diet, hydration, nutrition, labs, prenatal education, goals, mental and spiritual wellness, advocacy, upcoming testing, and everything else concerning pregnancy. When you go visit your OBGYN, those visits are less than 10 minutes long. If you are seeing an OBGYN, you deserve affordable supplemental prenatal care. And my last point is to report them. Protecting our bodies sometimes look like not allowing a medical provider to continue to have access to us. Report, report, report. If you are not feeling seen, heard, or respected from your provider, fire them. Report to social media, report to Google reviews, report to Rate My Doctor, report to their superiors, and fill out hospital surveys. Make it known, fill out hospital surveys. Make it known if you had a less than a compassionate experience with a medical provider. Protect yourselves by walking away. Protect your sisters by giving them a heads up and not being silent about things that matter. Sharing is caring. Your experience is evidence, and we believe you. As I close, protecting our bodies, it sometimes looks like keeping our pants on during prenatal doctor visits, but sometimes it looks like finding someone who actually cares. It's okay if you have to find a telehealth provider across the country or across the world to consult with. Protect your body by not settling, not just going with the flow because it's easy, because you're tired of going to visits. I'd also like you to reflect later today on ways you can protect yourself in your personal life and in healthcare settings. Protecting our bodies is protecting our future generations to come. We lead by example. We are teaching our children that their consent matters. We are setting the standard for how we deserve to be treated, because if we don't protect us, who will?
So good. So good. Candace, please do raise your hand. You should see a hand icon at the bottom of the screen. Raise your hand and I'll bring you up, Mama, for your Q&A. So good. I love hit the hand icon, sis. I love that she's giving us vocabulary for how we can protect ourselves. These stories are not shared. Mama didn't know what to tell us. Big Mama didn't know what to tell us, right? They didn't know how to advocate for themselves, and many times they just couldn't, right? Things were done to them. But now we know exactly, right, how to protect ourselves. Shadi said, keep your pants on. Shadi said, no, you're not going to do anything, right? I have to give you permission. Amazing, brilliant, Candace. Brilliant. You're on the stage now, Mama, so you can show your camera. Hey, girl.
Hey y'all, they got my baby.
So beautiful. I'm gonna pass the questions to you, Mama, but I gotta tell you, right, that this is everything we needed as we think about our entrepreneurial journeys. We can't compartmentalize. It can't be I'm gonna kill myself, but I'm gonna be around here to leave legacy for my babies. No, you're not, right? Like we need to holistically get free and stay free, and you are helping us to get free and stay free. So I'm going to throw these questions at you, Candace. First one. Wait, before I bring a question up, do you have anything you want to say, Mama?
No, thank you so much for this space. Thank y'all all for being in the comments and present today. I am just honored to be here with you guys.
Ashe, Ashe. Okay, first question is coming from Anika. She asks, what advice do you have if you don't have a diagnosis, but a lot of concerning symptoms?
Um, Feel free to DM me, sis, if you want to like talk more privately, and I'll tell you what labs to ask for. But I would
Oh,
start off with a CBC, a CMP, a mineral panel. Start with the basics and the thyroid panel. As mentioned, I know a lot of y'all were saying y'all need a list. I can type that up on a list and put it on social media too. But you'll also have access to this playback, so run it back and write it down. You want a CBC, which is a complete blood count, a CMP, which is a comprehensive metabolic panel. It lets you know just how everything's functioning, that kidney liver function. And then your mineral panel will let you know if you're deficient in vitamin D, magnesium, calcium, zinc, the basics that we need to function optimally. And if you're having a lot of symptoms, no diagnosis, and then find someone who will listen to you, because we shouldn't have to demand the labs we need. Someone should tell you what labs you need and then run them without a fight. So I would explore providers, and I will happily help you find someone in your area. Um, my mommy group, we have moms all over the nation. So I'll ask somebody in your city who they see, and we will find you someone to take care of you.
Ashe, the land of plenty is here. Beautiful, Candace. I love that. Um, I'm gonna bring the next question up, but I have to say, nobody ever did blood work on me without me asking what until I came to Nigeria, the continent. I was in Nairobi, Kenya. That's where I live. And literally, I'm like, I got a sniffle nose. They ran the labs and they're like, oh, your white blood cell count is low, your vitamin D is low. Like literally, and sis sent me home with zinc, vitamin D, vitamin C, it to heal me, So super fire. And I never knew that could be a part of the experience. So thank you for putting vocabulary even to what I experienced, because it should be commonplace. I'm gonna bring up a question from Tiffany Brown. Then I'm bringing you to the stage. I think it's Sharon over there, but I'll check it out in a minute. All right. So this question is from Tiffany. What if you are an overthinker? How do you overcome that? And Tiffany, more context in the chat just in case she needs it. But go ahead, Candace.
Yeah, so you said you put more in the chat. So I guess you were thinking maybe when we were talking about decompressing and releasing. Let me see if I can click over and see what else you were. Maybe as far as decompressing and releasing, write it down. If you're an overthinker, all of your thoughts and feelings are very valid. You're allowed to overthink, but you also have to give yourself space to take a break, to let those thoughts rest when they need to rest. So it's not a bad thing to be an overthinker. I'm always proactive with my thinking, but I also know that my mind deserves stillness. My body needs full peace. So that looks different for each of us. If writing it down and releasing it doesn't help, record yourself talking about it. Talk about it until you feel good about it. And just know that it's okay to think. It's okay. That's right. Ella says it's okay.
It's okay. Hey, Ella. She's so beautiful. Okay, so I'm bringing up Sharon. Sharon, the floor is yours. Whatever you want to say, ask, etc.
I don't know it. Can y'all hear me?
We can
Yeah,
hear
we can hear
you.
you.
Oh, okay, there we go. I'm on the move now, y'all. Sorry. I had to tap in because Candace was dropping bombs. I am a former birth counselor because apparently I like all the hats. Hi, Miss Ella. Um, I just wanted to say, listen to her. First of all, I want to give Candace her flowers because that was fire, and I wish I had you about 15 years ago, 10 years ago when I had my babies, because there was nobody saying this stuff. And a lot of first time Black moms, especially, do not have this information. We don't get the information that we are allowed to walk away from our doctor because just like everybody else, they are a service provider. You would not walk into a salon and let somebody mess up your head. So don't let somebody do that to your body. Um, I remember having somebody who walked away from their doctor at 40 weeks. She walked away from her doctor at 40 weeks and she delivered her baby at home at 42 weeks. That would not happen. That does not happen. Um, Take ownership of your body. There are programs out there. There's a beautiful program called the International Cesarean Awareness Network for those moms out there who have had C-sections and don't want to have another one or want to do the best they can not to have another one. And doulas. I love doulas. I love midwives. You can find a midwife in a hospital if you don't want to have your baby at home. Candace, I am grateful for you. I am grateful for all the doulas, the midwives, everybody that works in maternity, that is in these sessions today. I want to cry right now. I'm grateful that you are here, that you are speaking I'm done having babies, but I am glad that you are here talking to these women, because there are so many. My baby, I know that she will have the information she needs because women like you are out here talking and telling your story and talking about it, and y'all are challenging the woman whose name I can't remember, who spoke before about advocating for herself and telling her doctor what she was not going to do. I thank you, women, for standing up, because I did not stand up to my first doctor. When I told my first doctor that for my second baby, I said, he told me that if I did the same thing the second time around that I did the first time around, that I would be killing my baby. And I walked away from him. We can't let these doctors decide what we're going to do with our bodies. We cannot. They are not the end all and be all, because they don't do things like follow up. They don't keep up to date with what is right now. They don't educate themselves the way that they should. They are service providers, and they are not the end all be all. Get your second opinion, get your third opinion, and educate yourself, and keep up with people like Miss Candace up here. I am grateful for you, sis. Thank you so much. Thank you so much.
Thank you so much.
I feel your love from right here, and I thank you for your existence. Thank you for being here.
Thank you.
Beautiful, beautiful. I'm gonna flip some more flowers your way, Candace. So Pakita says, no question about it. I appreciate your thoughtful and thorough delivery. I had a former doctor who told me, even I need your permission. Women, especially Black women, don't realize that we have a voice for our health. This was brilliant. I agree. It was absolutely brilliant, sis. Let me see. So I'm gonna bring, and y'all gotta keep it. I can't even do it, y'all, because y'all listen. Okay, I can't bring anybody else on stage because we have to get to the next one. But I will show this next question, Candace, and it is, you already addressed it. So Wendy asked, "Is there a PDF available with these panels?" Wait, maybe that's for me. Wendy, the replays are available. Definitely follow Candace. Candace also said DM her. So literally click her name, right? You can DM her, you can set up meetings with her, literally, right? Like, no gatekeeping, like we here, for real, for real. Candace, I appreciate you, girl. Like, we talk a lot about passing along generational wealth, and we keep talking about the wealth they told us to care about, right? Like, we keep talking about the wealth of the explorers and the colonizers as if the queen had diamonds because she worked for it. No, she didn't, right? But you, sis, you are going to be the reason why our generations understand how to articulate themselves, how to advocate for themselves, how to demand consent, how to walk away, all the things. And that in and of itself is generational wealth. So thank you. I love you deep. I appreciate you, mama. Thank you so much.
Thank you.
You're welcome, beautiful. All right, y'all. So the next session is called I Didn't Want to Be a Mom. Yeah, we going there. We telling our stories and our words on our stages. I'll see y'all in the next room for Leslie Pittman's session. I Didn't Want to Be a Mom. Peace.